Chronic pain is common, affecting 11 to 38% of children and adolescents, with musculoskeletal pain being one of the most common types of pain. Pain may have an idiopathic origin, may arise from a disease process, from treatments such as surgery, from trauma or injury, and may even involve pathological changes in central pain processing. Patients with chronic pain may also experience functional disability, high rates of missed school, poor sleep quality, and mental health problems. A major limitation in treatment outcomes for chronic pain is the heterogeneity of the population. Each individual applies the term pain to a specific experience, usually related to injury in their life, leading to different perception and expectation of pain. Therefore, there is a need for a person-centered approach to the assessment and treatment of pain in children and adolescents. In the clinic, face-to-face interviews and questionnaires are the standardized clinical way to assess a patient's history on pain experience and their perception of it, but also their psychosocial factors such as pain catastrophizing, anxiety, and depression. However, researchers and clinicians have now also turned toward detailed phenotyping using other outcomes and tests such as quantitative sensory testing. Quantitative sensory testing, or QST, are standardized non-invasive tools that provide information on the perception and expectation of pain for each individual. The objective of the study was to subgroup pediatric patients with chronic MSK pain that will be phenotypically different from each other based on their psychosocial profile, somatosensory function, and pain modulation. We hypothesized that through patient-reported outcomes extracted from questionnaires and static and dynamic QST, distinct psychosocial profiles, somatosensory phenotypes, and pain modulatory responses would be identified in our cohort. Participant recruitment occurred between January 2018 and June 2021 at the orthopedic outpatient clinics of the Shriners Hospitals for Children Canada and from the Edwards Family Interdisciplinary Centre for Complex Pain of the Montreal Children's Hospital. 302 patients reporting chronic primary or secondary musculoskeletal pain and 80 age-matched controls between 10 and 18 years old were recruited for this study. After patients completed validated self-report questionnaires on various psychosocial factors such as negative thoughts while experiencing pain, functional disability, descriptors of pain, anxiety, depression, and sleep quality, our results identified patients who display adaptive pain mechanisms seen in blue, others displaying high pain and associated functional disability, anxiety and depression, and poor sleep quality in yellow, and others displaying high catastrophizing and somatization shown by the high use of different descriptors of pain in red. This result is important as it highlights the fear avoidance mechanism that may be at play in the two high subgroups. Psychological therapies delivered individually or in groups for these two subgroups may break their fear avoidance cycle, reduce pain symptoms, disability, and negative affect, but also modify social environmental factors to enhance functional status. Each participant underwent a specific protocol of mechanical and thermal QST, which included 7 sensory parameters to obtain a comprehensive profile of their somatosensory functioning. For the somatosensory profiles, a deterministic approach was taken to allocate each individual to the closest matching adult mechanism-related sensory profile. Out of the 302 patients, 51% were allocated to display normative QST values comparable to healthy controls. Thermal hyperalgesia was the most common profile in our cohort, who displayed increased sensitivity to mechanical and thermal stimuli. 15 patients were allocated to the sensory loss profile with decreased sensitivity to mechanical and thermal stimuli. Mechanical hyperalgesia was observed for 34 patients with marked gain in function in mechanical stimuli. This result is important because several trials in adults with neuropathic pain have used baseline QST phenotyping to identify predictors of treatment response that are relevant to the distinct somatosensory profiles and are supported by different pharmacological profiles. Each participant also underwent a specific conditioned pain modulation paradigm, which uses the concept of pain inhibits pain, such that the intensity of a painful stimulus in one area of the body, also known as the test stimulus, is reduced by the application of a second painful stimulus in another area of the body, also known as the conditioning stimulus. Using established cutoffs, 4 distinct pain modulatory profiles within the patient cohort were observed. Patients with efficient descending inhibitory modulation and absence of temporal summation of pain, patients displaying only temporal summation of pain, patients displaying only inefficient descending inhibitory modulation, and patients displaying both inefficient descending inhibitory modulation and presence of temporal summation of pain. This result is important because studies targeting the central pain processes have used physical activity or gabapentinoids inhibiting central neuronal sensitization to reduce the presence of temporal summation of pain, or have also used serotonin noradrenaline reuptake inhibitors to augment descending inhibition by spinal monoamine reuptake inhibition. Our results provide evidence that adolescents with chronic musculoskeletal pain are a heterogeneous population comprising of subgroups that may reflect distinct mechanisms and may benefit from different treatment approaches. Screening self-reported questionnaires and QST facilitate phenotyping of adolescents with chronic MSK pain in a clinical context. The combination may allow recognition of different subgroups of patients with chronic MSK pain and may ultimately contribute to personalized therapy.